Good afternoon. My name is Alden Landry. I'm the Assistant Dean for the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. And I want to welcome you all to today's webinar entitled Harvard Affiliated Radiology Residency Programs. The mission of the Office for Diversity, Inclusion, and Community Partnership is to advance diversity, inclusion in health, biomedical, behavioral, and STEM fields that builds individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. Today's program is part of the DICP's Visiting Clerkship program, which for over 30 years, the VCP has been a model for excellence, offering outstanding medical students, particularly those coming from groups underrepresented in medicine, an opportunity to participate in externships at HMS and its affiliate hospitals. Since its inception, over 1,500 students have completed the Visiting Clerkship program. Each year, we host a series of webinars to bring members of the HMS residency programs and the medical students together to share ideas, provide support, and address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding OA rotations, as well as other concerns that students may have. This year's webinars will include neurology, dermatology, otolaryngology, radiology, and urology. We will also have a discussion around the supplemental application, which many students have expressed concerns about as well. The dates for these programs will be listed on the final slide, and you may also find them on our website, which will be listed on our last slide today as well. A couple of housekeeping notes. The webinar is being recorded, and a copy will be sent to all participants, in addition to being posted on the DICP website. The chat function has been turned off. If you would like to ask a question, please post it in the Q&A section. And lastly, a short survey will be posted at the end of the webinar, and we would appreciate if you take a brief moment to complete the survey before signing off. Now I'd like to introduce our panelists. Our panelists are Dr. Sarah Durfy, who is the Director of Diagnostic Radiology Residency Program at Brigham and Women's Hospital. She previously served as the Director of Medical Student Education in Radiology at Brigham and Women's and at Harvard Medical School. Her clinical practice is in the ultrasound division, where she interprets all types of ultrasound exams. Next will be Dr. Julian Chang. He is the Program Director for Diagnostic Radiology Residency and Neuroradiology Fellowship at Beth Israel Deaconess Medical Center. He is also an Assistant Professor of Clinical Radiology at Harvard Medical School. And last, we will have Dr. Leila Khorashati. She is the Associate Director of Radiology Residency Program at Mount Auburn Hospital, a graduate of Dartmouth Medical School. Leila was a resident at Mount Auburn Hospital from 2005 to 2009, following which she completed a musculoskeletal fellowship at the University of Washington, Seattle, and a cardiothoracic fellowship at MGH. She joined the faculty at Mount Auburn in 2011, and her interests are in lung cancer screening, lung nodules, and cardiac imaging. And with that, I want to introduce our panelists to allow them to just share a little brief insight about each of their program before we go into specifics. And so, Dr. Khorashati, I'd love to turn to you first. Tell us a little bit about your residency program.
Sure. Good afternoon. I'm Leila Khorashati, one of the assistant program directors here at Mount Auburn. We have a small, very quaint program. Our faculty to resident ratio is about 1-to-1 or even more faculty than residents. We have no fellows, so the residents typically are first up for any procedure or any questions that we might ask. There's independent call, but very well supported. There's always 3 faculty members on call for general call pool, MRI call pool, and IR, but you get to make the decisions that you are comfortable with on your own. It feels like a family type of atmosphere. Everybody, it's too small to get lost in the shuffle, so everybody knows everybody, and we try to help out each other any and every which way we can. It is located in Cambridge, so we have all the amenities that Cambridge and Boston area has to offer. We have several opportunities in the program itself. We have leadership and educational fellowships that we offer to our residents. Most of our residents are very well liked as fellows wherever they go. I always tell my residents, look at the list. If they take repeat fellows, it's a good sign. And we always place outstandingly in the nation as far as fellowships are concerned. Either we go where we want to, or we stay locally and have great programs in town to go do our fellowships. And we have a high volume and diverse cases in our own hospital. We also go to Boston Children's Hospital for focused training in children's or pediatric radiology, as well as we join the radiology residents at MGH for ER rotations, and also rotations in all of their subspecialty sections, so that we see the less common cases of zebras. We were one of the first 6 programs to have our ESIR pathway approved, and so our residents have a direct IR pathway. We also offer an ABR certificate in diagnostic radiology with subspecialty in nuclear medicine at the conclusion of your residency. It's 16 months of nuclear medicine that we do here at Mount Auburn and also at Brigham and Women's Hospital. We also have, most of our residents, but it's almost a complete mix, 50-50, who goes into academic radiology versus who goes into private practice. A lot of our old graduates have become program directors themselves. We have several who have become chief radiologists for their departments. And as a whole, we have a lot of residents who do participate in the politics portion of medicine as well. Every year we support 1 or 2 residents to go to the ACR meetings, as well as participating in the Mass Medical Society. Several of our residents have been secretaries in the Mass Medical Radiological Society, as well as past presidents. So we really do like to engage our residents in every aspect of their training program here, so that we have residents who feel comfortable going out in the community, practicing in private practice settings, or going into academic radiology and being involved on a national and international level. And thank you for giving me the opportunity to talk.
Awesome. Thank you for sharing about your program. Next, we will go to Dr. Chang. Dr. Chang, you want to share a little bit about your residency program?
Sure. My name is Julian Chang. I am the program director for the Diagnostic Radiology Fellowship, residency at BI, as well as the Neuroradiology Fellowship program director. I did my neuro fellowship here and stayed on the staff in 2015. BI is probably the largest of the Harvard system hospitals to retain independent call. As you heard, Mount Auburn does as well. We are a multi-center referral network known as Beth Israel Health, about 15 different hospitals, which feed into our system. And as such, the trainees will see a broad case mix, from bread and butter cases to very complicated tertiary referral studies. We have a very busy ED section, and like I said, when you have an independent call, you are the person who will be ultimately responsible for making the call. And so as such, our residents are independent, and it is a resident-run program. We have a large number of fellows, I can attest to that, but the case volume is such, and the emphasis on resident training is such, that typically the residents will have first crack at any procedures and other things like that. We have a unique quality academy for certification in QA and QI competency. I believe we're the first in the nation to have it. Stanford came in about 2 weeks after we did. This year at our graduation, we actually awarded the certification to 2 of our residents. One was a graduate in 4th year, one is 2nd year. We are a sort of moderate size to sort of largest residency, credentialed for 40 residents overall. We take 8 a year. We have the IR program as well. We also have independent IR spots, and we also have an ESIR position. And as Dr. Farshadi mentioned, like her, our residents go to top fellowships and sort of around town. MGH, Brigham, as we were mentioning, will stay here with me, Stanford, etc. Wherever they want to go, typically they'll get the first choice, and geography is not a limiting factor. Many of our trainees go on to top academic radiology positions as well. We have multiple, I think at least 6 or 7 of our trainees have become department chairs. We have someone coming in soon, in a couple of weeks, who is even a CEO of a small hospital in Maine. And for 5 years in a row, we've sent our one of our residents to the AUR Herald Leadership course, which is a nominated and selection process course. And so we can say that we definitely have training and lots of opportunities for people who are interested in academic radiology and administrative portions of it. Thank you.
Awesome. Thank you, Dr. Chang. And last but not least, Dr. Durfy, can you tell us a little bit about your program at Brigham?
Absolutely. Hi, everyone. Thanks for having us from the Brigham here. Just a little bit about us. I kind of have a busy slide because we have a lot going on in our residency program. I think the highlights I wanted to emphasize are, number one, that if you come to the Brigham for radiology residency, you're going to get a very strong clinical foundation. We have opportunities to work in all the different subspecialties of radiology, including rotations at Children's Hospital, which is across the street, through with lots of pretty great attendings to get a really broad experience. Also rotating over at Dana-Farber to get that cancer imaging experience. Aside from the strong clinical foundation, we have opportunities as other programs have as well in terms of research opportunities. We have a research pathway. We have education opportunities for people that are interested in education through many sort of programs through Harvard, through our department, and through the Brigham Education Institute. We also, our 4th year is very flexible, which is pretty cool. So once you pass your core exam in your 3rd year, our 4th year is sort of you make your own adventure. So it can be a mini fellowship in any of the clinical areas that you can design, but we also have opportunities at working in the Center for Data Science. If you're interested in data science and informatics, we have others who've made their own sort of mini fellowship in education or in leadership, using different sort of resources that we have within the hospital. So, and also obviously research opportunities as well. So there's also opportunities for professional development, as other programs also have. We've sent residents to all sorts of different national meetings for developing and growing in leadership, admin, clinical, just sort of outreach type of opportunities. We also have resident-run interest groups, which are kind of cool. We have a wellness committee that does something probably every month and has a nice budget for lots of community building events, including a retreat, an annual retreat that we have all residents participate in. We have a DEI committee, which is has many activities throughout the year, which is resident driven, but we also have a DEI office within our department. So sometimes we do activities with faculty and others. I did want to give a quick shout out. We are running a small radiology course, online non-credit course in the evenings in August. And I can send information to people that might be interested for students underrepresented in medicine who are interested in radiology, which will include learning about radiology, but also about we set you up with a resident and faculty mentor, which has been very successful. This is our 2nd year running that, which is really great. We have an education committee. We have a pretty robust women in radiology group. And I think probably the biggest thing about our program is the community. I mean, we have some really fantastic residents and fantastic faculty and mentors. So it's a really great place to work. I've been there a long time. And I think that's it.
Awesome. I want to say thank you to our program directors for taking time out. I know that you have a new batch of interns who are coming aboard, and Thank you for just taking part of your time to be with us today. In the interest of time, we will jump right into questions. And I have a lot of questions. Hopefully we can keep our answers brief so we can get through as many as possible and try and stick to schedule. But just to give you all a heads up, a lot of questions we're going to try and cover in the next 40 minutes or so. But I want to start with a relatively general question for you, Dr. Chang. From a program director's perspective, what are your overall thoughts about this application cycle and how it may be different to last year or years prior to the pandemic? What do you think is going to be potentially different about this application cycle?
With the USMLE Step 1 becoming pass-fail, I think this cycle will be a little bit different than others insofar as it used to be in many specialties, and I suspect radiology quite a bit. It was a filter, as it were. Most programs can't possibly interview the number of sort of applicants that they get. A program might get 800 to 1,000 applicants, but you really only have spots for 100 to 200 people. And so with that, there've been a number of small studies that have been written up and published in academic radiology. And I suspect that this is what's going to happen, is that the people will default to Step 2. And then what programs will do is then look at more heavily the academic performance of your school. So if you come from a school where they don't really grade you, they don't rank you, it becomes a little bit more difficult, I suspect, for people to tease you out from the rest of the pack. The papers that have been done on this with surveys and program directors and what they would likely do, there is an unfortunate possibility that things like letters, and the prestige of your program will become more important without the crutch of Step 1. So I suspect that this will be different, obviously, than pre-pandemic. I'm not quite sure what the radiology sort of committees will say about this coming year. The last 2 years, everything has been virtual. I know IR is going to stay virtual. My suspicion is that we will stay virtual as well, simply because it's a great equalizer. You don't have to pay for travel, living expenses, etc. And so people can apply broadly and to programs that they wouldn't otherwise be able to go to. I hope that answers at least part of the question.
No, it did. And I think it gives us a lot to unpack over the course of the next 40 minutes or so, because there's so many questions that the students are having when it comes to, letters of recommendation, personal statements, as well as timing of Step 2. And I think all of that is important. And I think this was really a great setup for my follow-up question to you, Sarah, is someone who has been engaged in medical student learning and interacts with students. What are you hearing are some of the concerns that students are having regarding this upcoming application cycle?
Well, I think, some of the concerns that Dr. Chang was talking about, for sure. How are you, in radiology, which is a fairly competitive and popular specialty right now with high numbers of applications, how are you going to have your application stand out? And we review all of our applications holistically. So the STEP score, while, it can help you if it's good, we weren't discounting people. We didn't have a lower threshold by which we won't even review an application. We review every application. So for us, the STEP scores being pass-fail is not as much of a change in terms of how we go about doing this, filtering or getting, sending out our interview invites. But I think for applicants, just knowing how to make your application really represent you the best is the hardest thing. And I think, we'll have to see how the supplemental applications play into that, because that's a new thing for radiology this year. And, I think that really provides an opportunity for students to really highlight some of the things that are important to you, because when you're looking at all the different activities that students are doing and trying to figure out what is the most important to this student, how am I going to think about this student and how they would fit into our program? I think the supplemental application can be very useful in that regard.
Awesome.
So I think the virtual interview thing, anyway, someone else can answer. Sorry.
No, I'm sorry. I didn't mean to cut you off. It sounds like you were going to say more, so my apologies. Because I think the supplemental application is such as gray zone that we're trying to deal with. So many specialties are new to this, and some adopted it last year, others didn't, and we're really sort of at this uneven pacing as far as how we're going to go about with the supplemental application. So my apologies, Dr. Durfy, for cutting you off.
Oh, gosh.
So I have a question for all of you as program directors, and I'll start with you, Layla. What is your program doing to address any issues related to DEI in the program, and how are you embracing these thoughts around health equity?
So I'll answer the second question first, and I'll go back. And I took some notes because I think this is a very important issue. And although we don't have a DEI office, it is at the core of our beginnings of our program initially. And so our program is actually one of the 4 beta sites for having the educational series that the APDR has to offer. So our residents will be getting 4 lecture series that are designed to help educate everyone about the issues. And hopefully soon it'll also be rolled out throughout the APDR, and all the programs will have it as well. So that's the first thing that we're going to try to start with, educating everybody about the issue. And going back to addressing the issue of DEI, it's important to know where we started, where we are at. I think our program is unique in a sense that even our creation was based on that. We were created by a nurse during the 1800s. She was from an abolitionist family. She was a woman, of course. And so our program was set up by a woman in an era when not many women were in medicine to begin with. And then our department to begin with was founded by a radiologist who fled Nazi Germany, and he came here and he set up our program at Mount Auburn Hospital. So at the core, this issue has been always important to us. And if you look at the residents we've had over the years, to us, it matters who you are as opposed to anything else. And it matters that all of us residents get along together. That's the most important thing. And to try to introduce our program and what is important at the core to us, our program director is one of the first radiology residency program directors that was involved with the Harvard Medical School in introducing our program. He was a participant in the URIM program, and also our residents have always participated. One of our residents actually has every year presented, Menora Lake. I know you know her, and so that's another thing. And also we frequently get the award for holistic treatment in our community, especially the LGBTQ community has always commended us in our treatment and that we offer. So I think for us as a whole, even though we don't have a office to address it, it's such an important part of all of our lives. We all have different backgrounds that we came through. So it's part of who we are.
Awesome. Thank you. Sarah, I'll turn to you. Same question.
Oh, okay, sure. I was just looking for something. Sorry about that. So I think that we've also we did the health disparities curriculum that was designed by the APDR and sort of championed by Carolyn DeBenedictis at UMass, actually. And it's a really, really great program to sort of introduce healthcare disparities in radiology to our residents. And so it's been very well received. It's a wonderful program. So I think you guys are going to really love it too. And in fact, we're adopting one of the sessions into our mini program we're having in August for students, so that they'll get a chance to see that too. In terms of DI initiatives, we are really carefully screen all of our applications to really try to surpass benchmarks for URIMs and women in radiology, which are very low nationally. And we've been able to sort of surpass all of those benchmarks and try to really build momentum around recruitment to get a more diverse residency. And so we're really proud of that. And then a lot of the DI initiatives that we've, as I've said, have done sort of within our program throughout the year. We did some activities around Black History Month. We've also invited a couple of prior residents who are now attendings. One is Valerie Ward, who's at Children's Hospital and runs, she's a big muckety muck at Children's, creating opportunities and improving diversity at Children's Hospital throughout the entire hospital. And we've done journal clubs with her and with Kemi Babegmami, who's the vice chair at Cornell, and did a nice journal club with her as well. So nice way to bring back some of our prior residents and talk about some really important issues.
And last but not least, Yu-Ming, do you want to try and address the question as well?
Yeah, well, in our program, when the department, my immediate boss, Dr. David Hackney, is our vice chair of diversity and inclusion. My understanding, and I could be wrong, but he was, I think, the very first African-American neuroradiology fellow at MGH. At least that's the story I hear. He never says it. And so we've been sort of creating committees. He's forming a resident committee, for example, to help oversee updates to our websites to sort of include more of our DEI and URI outreach programs as well, and which will include residents as well as faculty. One of the things that sort of more concrete things that we've been doing, a few of our as Dr. Durfy probably alluded to, many of our residents are represent minorities. We tend to do better than the national average. So we've been able to establish outreach programs. So for example, one of my graduating residents, who's not a URM, but went to Meharry, actually established a sort of a teaching a course with them, and to sort of introduce them to BI and to sort of introduce medical students to the world of radiology in general. One of our current graduating residents who is staying on as a fellow is a Howard alum, and we will be doing the same thing with her as well, to sort of reach out and sort of directly sort of reach out to schools with high proportion of underrepresented students.
Awesome, thank you. And shout out to HBCUs as a proud product of an HBCU. I love to hear when our institutions are engaging those institutions of higher learning. All right, so let's jump into some questions really about radiology as a specialty. Sarah, there are some students who may not be in the application cycle this year, but maybe in future years, and they're trying to decide if radiology is the right specialty for them. What tips do you have for students to make that decision to say yes to radiology?
Well, I'm a good person to ask because I mastered internal medicine. So, and then I switched into radiology after my intern year. So clearly I did not have enough exposure to sort of see the light or the dark when I was a medical student. I think it's very challenging for students to get enough exposure to radiology, particularly most schools don't have radiology as a required course. So you may or may not even, you may not be exposed to radiology or even take a course or a clerkship in radiology until the end of your third year or your fourth year. So then you feel like you're a little bit behind the buck. So I would say, good for you, you're here now. So you're clearly thinking about radiology. I would say reach out to people at your medical school, some radiologists, talk to residents, talk to fellows. We have people that reach out to us and in our residents as well, looking for guidance and, sponsorship, advisorship. Just ask people, listen to their stories. My son's out of college now, and some of his friends were thinking of radiology. And so they reached out to me. I just knew them as high school students a while ago, but maybe you have family friends or others that you can talk to about that kind of choice, because it is a big choice, but certainly it's been something that I've been happy with, but it's challenging, I think, compared to other specialties.
Awesome. And Layla, many students use away rotations to learn more about residency programs in particular, or even to really fill out if they're making the right decision about the specialty that they may be applying to. What are some of the pros and cons of doing away rotations?
it's hard for me to think of cons as far as if you're interested in radiology. There are a lot of pros. For one, you get a feel for the program. You get to see what the radiologists do, what the residents do day in and day out. I have never seen or heard of a program that doesn't like visiting students and coming to see what we do. In fact, most of us radiologists have a bad rap for being in a dark room. We love talking to people. In fact, we talk to our dictaphones all day long. But it's a great way to introduce yourself. It's a great way to get a feel for the program. And I say feel because everybody, you will really learn radiology wherever you go. It is the culture of the place that you want it. You want to make sure you fit in. You want to make sure it's a place that elevates you as a person, not just a radiologist. Everybody, will learn radiology where you want to, but you just want to feel supported in the 4 years that you're there. You want to make sure that it is a holistic approach to your learning process. And, it's from our perspective, it shows that you're somebody who's willing to go above and beyond to show that you're interested, not just, in the radiology, the learning process of radiology, but also in us. It always makes you feel good when somebody's interested in you particularly. So that's a great way to tell us you're interested in us. You get to know the other residents and you get to ask the questions that may not feel comfortable asking if you were just meeting them online for the first time. Or hanging out with the residents to see if this is somebody you want to be with for the next 4 years. So there's a lot of pros. I would recommend, if you have a radiology program, if you want to get introduced for the first couple of weeks in your own program, and then go to different places to experience it. I did. I flew as far away to California, and I love the program. I hated traffic. I realized, who knew? So there are little things you learn about a place, the culture of the place, whether you want to live in that area. Those are little things that you may not think about. So there's, to me, lots of pros, really very little cons.
Yeah, thank you. I'm a product of visiting clerkship programs, and that's how I found out about this opportunity here in Boston. And you're right, there's so many upsides to that. One of the things that happens though is a student can't rotate everywhere, and whether it's their own schedule or they have a conflict or whatever it may be. So how can students learn more about a program, and is there value in reaching out to either current residents or faculty to learn about the program?
Definitely, particularly residents, to be honest, because you're more likely to get a true feel of the culture of a place and what's happening at the time of the educational program. If you talk to current residents, and in fact, we have multiple sort of applicants who reached out to friends or acquaintances they knew in our program to discuss, and some of them actually ended up matching with us. I would say that talking to faculty might be helpful. My suspicion, though, is that at least from my perspective, it's less helpful insofar as the faculty tend to be sort of more politic in how they describe a program. And so, for the nitty gritty, you should probably talk to a fellow trainer.
Awesome. Thank you. Sarah, I'll turn to you. As students are in this process, they are thinking about what their portfolio, what their resume is supposed to look like. What should students be doing now to ensure that they have the right rotations on their application that you're going to be looking at in a few short months before they apply? What should students have done?
Well, obviously you want to do some radiology. You need to have letters of recommendation from probably either a radiology clerkship or an elective that you've taken. Someone who knows you in the radiology sort of world. You're going to need, we also look at your sub-internship, right? And I'm sure they're required in most medical schools, and you're going to need a sub-internship for that preliminary year that you're going to be doing. So we take those letters and your grade, your evaluation from that rotation very seriously as well, because that sort of shows your how you work in a team, or how everything went, your medical knowledge and all of that. So that's very helpful as well. In terms of the number of radiology electives you would need to take, I mean, maybe a couple, you don't need to spend your entire fourth year doing radiology to go into radiology. I mean, I advise students, you know, if there's something that you're dying to take because it's just a really cool course or something you really want to learn about before you finish medical school, you know, go ahead, take that course because it'll be your last chance to do that. But you want to round out your application. It's not just about your grades and specific rotations, but getting involved in projects or research type of activities. I mean, I know a lot of medical schools require some sort of project or sort of long-term research activity. It could be sort of an educational project or, you know, something that you spend some time on, sort of a capstone project. I think that would be very helpful. And just sort of shaping your application so that we have a sense of where you're headed. I mean, you don't have to know 100%, but, you know, if you have a passion for healthcare disparities, or you have a passion for global health, or, you know, education or research or whatever it is, you know, you want your application to reflect that so that when we read your application, we know that that's you.
Awesome. Thank you for that. Layla, I want to maybe dive into this a little bit more. When you as a program director are assessing a students and you're looking at those clinical rotations, what information are you looking for to assess how a student may transition to be a resident? Are you in, you know, what are you looking for in those letters? What are you looking for in the MSPE? What are you looking for in those grades? And then also, what are you looking for in a student who does an away rotation?
So there's usually each day we interview, there's 5 people. There's 3 residents and 2 faculty members. And we basically comb through the application. Of course, every one of us is looking for something different. I was a resident here, so I can tell you what as a resident I was looking for and what as faculty. We, you know, overall, we're all looking for team players. This is, I think, very important. And I think, you know, somebody who's likable. First and foremost, it's 1-to-1 ratio. You always sit next to this person for 4 years. Are you going to be able to sit next to me? Am I going to be able to sit next to you and work together for 4 years? We all have the same goal to learn radiology or teach radiology and do the best clinical work we can do. So I'll be looking for any signs, you know, or anything that would tell me, who is this person? Is this person a team player? Am I going to be able to work with this person? Also, you know, we are all, you know, it's the radiology is one of those subspecialties. Most people out in the community don't necessarily know we're doctors. We are doctors, and clinical medicine is a big part of what we do. So I am looking to see somebody who's a strong clinician at base, who's built on that and become a good radiologist. So it all matters, but, you know, somebody who's likable, somebody who's dedicated to the profession of medicine, who's a team player. As a resident, I know I'm looking for somebody who's willing to say, I'll swap that shift with you, and I know you're going to pay it back. It's those things that we're looking for to make sure that this person's diverse enough to fit into our group of people who is able to provide good, strong clinical medicine.
Awesome. And one of the ways that we learn about who we may be accepting into our residency program is letters of recommendation. So for you, Ming, can you talk a little about the letters of recommendation? What should students be doing to secure a strong letter of recommendation? And who should they be asking for these letters of recommendation?
So I'm not entirely sure where the opinion lies amongst the collection of program directors. I can only tell you what I feel, and is that I would much rather have a strong, sort of short but detailed letter of recommendation from someone who knows you well, who can say definitively what you've done with them and how well you performed, even if it's from a junior faculty member, rather than a short, brief pro forma letter of recommendation from a huge name. And so, the key here is to have someone who knows you well, who actually has worked with you and can say definitive things and examples of how you fit into a program and what your strengths are. You do not want, at least from my perspective, let's say a 4-letter letter of recommendation from a department chair who has maybe worked with you once or twice. That's not necessarily going to help you. Now, if you have a very sort of glowing letter from the department chair, then obviously that is very important. But the most important thing is someone that you've worked with closely, who obviously likes you, and knows you in and out. That's the most helpful letter. Obviously, as you then you would try to work with people higher up and more well known, would definitely be helpful as well. But the most important thing is a strong letter from someone who knows you well.
Awesome. And Sarah, this is something that I get questions about often from students, is this personal statement issue. And they want to write these amazing, pieces of literature, which oftentimes hampers some students from even getting anything done. And so I guess my question to you is, as a program director who reads, hundreds or thousands of personal statements, what are you thinking about when you're reading a personal statement? What should students be thinking about when they are writing their personal statement? And what makes for a strong personal statement?
Yeah, there's so much angst around the personal statement, and people spend a lot of time on that. I mean, I guess I would just try and use the personal statement as a way to sort of showcase yourself, who you really are. It doesn't have to be fancy. It doesn't have to be, poetry, but it needs to sort of just clearly talk about you as a person, where you're coming from, where you think you're headed, what you're most proud of, sort of so that it sort of encapsulates you as a person, which, it's kind of hard to do in one page, right? But I think, just those are sort of the best personal statements. It just sort of sums everything up a little bit, but to be fair, I don't think you have to worry about your personal statement. I mean, most personal statements are very good and they give us a sense of who you are, but you don't have to get fancy to try and stand out with your personal statement, because that I think that may not always serve you the best.
Thank you. Layla, we touched on this earlier. We were talking about step one, but I'd love to hear your thoughts as a program director, or just thinking about residencies for radiology in general, with step one being pass-fail, your thoughts on how this is going to be transitioned either across the board or maybe specifically for your residency program, with step one being pass-fail.
I think for us, it really isn't going to make that much of a difference. Like I said, we go through the entire application, so we don't look at you as a number, we look at you as a whole person. And so, we all read the personal statement, and the letters of recommendation very closely. We do look for the overall, what you have accomplished in the 4 years of medical school, but also who you are, what you have done on the side, whether you are a soccer player or a soccer fan. There's a lot that makes you very interesting and a good, attractive applicant, not necessarily what you had on your board score. So it's, from my perspective, for our program, it's not going to change much, because we've never put much value on that. I always like the personal statement because it tells me who you are other than your numbers. And that's the best personal statements I've read, are the ones that tells me actually something that's not even in the application, what you accomplished because of what happened, or something like that. Like Sarah said, it's a different way of looking at you, as opposed to has always been the traditional up to getting to medical school. Up to when you entered medical school, it was all about your numbers and all, but then after that, you are a clinician. So it's sort of different. It's a benchmark, of course, you look at it, but it's not the most important thing in the application.
Awesome. And go ahead, Sarah.
I just wanted to piggyback on what Layla said briefly. Sorry, I didn't mention this, but if there is something in your application that is going to stand out in a not positive way, let's say you had to retake an exam or something like that, if there's a reason why this happened, and there almost always is, the personal statement, you can use that as a way to sort of address those concerns that someone reading your application might have, because I think it always works better, at least in our program to sort of be transparent about that, because we understand and, won't have questions about it. And, it's just, it works a lot better if you're in a situation like that, at least for our program.
Awesome. And you mean, one of the things that I'm doing as I'm advising students is, I would typically advise students to take step 2 at some point during their 4th year, whenever their school requires it, so that they can graduate. But now where I'm working with students, they're planning on taking it earlier and earlier, oftentimes because they want it to be a part of their application to applying. And so for those students who may not have taken step 2 prior to applying, is this going to be a hindrance to the application, or should students try and have step 2 taken before, that end of September timeline when they're going to be submitting their application?
I think it really depends on the program that they're applying to. As we just heard, Mount Auburn and Brigham don't really sort of use scores as a cutoff. BI doesn't either. However, the published papers show that the majority of the surveyed program directors will do that. And as such, it probably is best if you do have the steps 2 ready to go, to sort of cover that aspect of it. There are plenty of programs who won't and will be able to look at everything holistically, but that limits you to those programs and may impact you negatively in the other programs. And it's very competitive out there. I think this last cycle we had 20% more applications than usual. And if so, it makes sense to put your best foot forward, because you're not necessarily going to get to the program that you think you're going to go into. And so you should be prepared. I think that's probably the soundest advice.
Awesome. And I appreciate the honesty with this conversation that we're having as well. Sarah, we started talking about this earlier, this sort of unknown that we're about to venture into with the use of supplemental applications. Can you talk to us just sort of globally about what radiology residency programs are going to do in regards to a supplemental application? What is it even going to be structured like?
Well, I haven't seen the application itself, but my understanding is you have an opportunity. So programs can sign up to use a supplemental application. And this is the first year that it's happening. So I don't know if all programs will. I'm assuming, given the increased number in applications, most programs will. And it is meant to give applicants a chance to highlight important parts of their application and sort of dig a little deeper into certain aspects of themselves or something on their application that they want to talk more about. So and then there's also geographic signaling that you can also do, which is more to the advantage of the applicant as opposed to us on the program side. We won't see that you signaled somewhere else, but we won't know that you signaled anywhere. So it's to your advantage to use some of these tools. My understanding is that the signaling and supplemental applications are to be used to grant interviews, and not necessarily in terms of once you're interviewing a candidate and ranking them, et cetera, that this type of information is more for interview invitations as opposed to anything else, but remains to be seen. We've talked to some other programs here at Harvard and felt that it wasn't as useful as they may have thought. But it's unknown. We don't know. I don't know what others think about this.
Others, any thoughts about the supplemental application?
I do know that RIR program director, they actually participated in the supplemental application, and they're fans. And in fact, this year they thoroughly encouraged us to sign up because of the geographic signaling. It turns out that it predicted who came to the program.
Interesting. All right. The general piece of advice I was talking to students, because I understand for some spaces it may be optional, you should do it just to make sure that, again, as you may mention earlier, put yourself in the position to be, in the position to have as many opportunities as possible, whether it's having step 2 ready at an early point, making sure you participate in the supplemental application, because you want to make sure that you're setting yourself up to succeed. Layla, I know we're running out of time, but just a couple quick questions for you and the rest of the group. The interview process, Yiming mentioned that IR is going to be virtual. Has there been a decision made about what radiology is going to do for DR programs?
We haven't made a final decision. Of course, we prefer in person because of what we talked about, the feel of the program and your day at the program to see what day, a day in the life of a radiologist at Mount Auburn would look like. Having said that, we've also done, I think, a pretty good job assessing and conveying the feel of our program over Zoom. And I tell for the people who are watching this program, I would say we do pay attention to everything. I make a point of looking at the background. So how you set up your background. One of my own personal pet peeves is when it's a blank background and it's all blurred. First of all, it looks like a blurry image to a radiologist, which never goes across well. Second, we are trying to learn more about you. So the more I see about you, the more I feel better about myself. So that's why my personal preference. So, I have noticed, and some people do pay very close attention as to what they have behind them, or it does shine light on who they are and what they are going through at the time. Always smile. That's important. During the interview, even if it is on Zoom, it may sometimes feel like it's less formal as far as an interview goes, but we're paying attention to all the little details that goes around. And last but not least, it's harder because you're sitting there in your own living room, and sometimes we do pay attention when the camera's off of you. So, I've seen some people fall asleep just like they would do in a normal interview. So all the little things that go on in a normal day happens on Zoom too. I don't like when people freeze their image as they're going in between. And so those are the little things that I would say, for me personally, I find and I pay attention to. So have a little area where you feel comfortable with that shows the background that you like, the plant, the orchid that you have been culturing in your, then you can talk about it. It has come up, the background has come up in my interviews. So those are the little things that I would talk about, but I hope we can go back to in person, only because I'd like the candidates to see our program. Having said that, I do also recognize the benefits that Zoom has provided. I was once the medical student who had to fit in, 10, 11 interviews, and between flights and the hotels and then at time of Zoom, that can be difficult. So it's sort of a work in progress, but we're getting more and more used to Zoom, and it's one of those things that may stick around because it's much more convenient for our students, to be honest.
Well, I learned a lot about radiologists and their preference for backgrounds right there with Dr. Korashadi's emphasis on motion artifacts. So thank you for that.
Don't look at my background right now.
You mean one of the things that happens is sort of this peri-interview communication, whether it's a student does not get an invitation, they get waitlisted or they get rejected and they reach out to the program, or after they interview at a program, they reach out to the residency program. What are your thoughts around this communication around the interview season? Once the applications are submitted and a student doesn't get offered an interview, or even post-interview communication?
I think actually it may be helpful. And again, it's program specific. We've done these panels, a lot of these panels over the years. And every time I say something, you will have someone else who says the complete opposite. So for example, I love thank you notes and cards. But then I've had someone from surgery say they hate them because it makes them feel like they're desperate. And that's an immediate turnoff, which kind of tells you the differences between radiology and surgery, at least from my perspective. But that being said, I think it actually is helpful. If you're competitive, but I only have 50 spots to offer, and I put you on a wait list and you send me an email, then suddenly you're going to be moving up to the top of the wait list. So I think it is helpful. And sometimes it's helpful to so even after the interview, because again, you've got. I always make this joke, and I hope this doesn't sort of sound like I see everyone as a mass, but in general, most applicants can be kind of grouped into tertiles, I guess, and very often their accomplishments look pretty similar. And so if you tell me that you want to be here, then I'll probably look at your application in a different light, even though you're in this huge pack of people. And I don't want to make it sound like we don't think that everyone is special. You are, but when you're seeing 1,000 applicants, sometimes little things can help. A little bit of a snowflake that kind of causes an avalanche. And so definitely, I'm a big fan of communication. As long as you don't, and make sure you stay clear of any NRNP match violations, that sort of thing.
I think that's a really important point is, making sure that if you are communicating, you're saying it to the right program and you're staying within the boundaries of what we're allowed to do in those post-interview communications. Given the interest of time, I just want to ask this one last question, and I'll popcorn around, maybe starting with you, Sarah. Lots of students are going to be watching this program, asking questions about, as they're about to venture into this process of applying to residency. Do you have any piece of advice that we haven't covered, any comments that you want to make sure that students know before they sign off and go on about the rest of the application season?
I guess, I think we've covered most of it. I think as you're looking at programs, really do a lot of research, reach out to people, take advantage, of email and Zooms, and go to the information sessions that are in the evening, sort of in the fall. A lot of programs have information sessions, so you start to get a feel for a program. I suspect that we're going to be virtual this year. Our GME office has said as much, and I think others will follow as well. So, but it does give you an opportunity to really, ask lots of questions, connect with people. I agree. Emails, a small number of emails around the time of when interviews are being granted, and then after. And then if you know that the program is your number one program, sending that email. I know it's hard to press send, but it may help, right? So just really sort of being proactive and reaching out to lots of residents, lots of people.
Dr. Khorshidi.
I was just going to tell our applicants who are watching this, congratulations for having made it this far. You are already a fantastic candidate. You're already motivated because you are here and you've joined us to learn more about our programs, at least in the Boston area. Even if you're not a visual person, you can make a great radiologist. I am not a visual person, but I do love radiology, and it is important to love what you do. So focus on that. And, if it is available to you, do your rotations in radiology, see if you like what we do day in and day out. It is not the traditional people think, dark room, no communications with anybody. We are on the phone all the time. We're communicating with our clinicians all the time. So it's not that black box that nobody knows what we do in the dark room. And also, I was going to say, if your program does not have a radiology medical student rotation set up, one of our residents it has a YouTube channel, and Yasha Gupta does a lot on YouTube that talks about day in and day out life of a radiologist, what she goes through on call. It may be an insight into our program, and maybe an insight to teach somebody about what radiologists do, and maybe you might have your aha moment at that time. So these are some of the things that are available to you. And if you have any questions, of course, reach out. We're always available we're more than happy to talk to you about what we do all day long. And choose a program that helps you elevate you. You're going to be a great radiologist wherever you go, but you are also growing as a person. Life goes on while you're doing the radiology residency, and help you become who you want to become.
Awesome. Thank you. And Yu-Ming, one last closing piece of advice for students.
I think Dr. Durfy mentioned do your research, and that's really important because every program has its own flavor, and you would want to find something that might fit your personality the best. Sometimes it's not prestige with the size of the program. Sometimes it's a smaller program where you can get more one-on-one interactions with your colleagues and attendings. Sometimes it is a huge academic center because you are a researcher and you want as many opportunities to do that as possible. But it's really important to sort of figure out who you are and what programs will fit you the best, I think. And so that's, I think, the best advice I have is find where you'll be happy.
Awesome. I just want to say thank you to all of our panelists, Dr. Chang, Dr. Durfy, Dr. Khorashadi. Thank you for being here and sharing your insights into your experiences as program directors, and hopefully to answer any questions that students may have around the application process. As you can see, the survey popped up. Feel free to click that through that very quickly. If you have any questions or you would like to watch this video, you can turn to our website where this webinar will be posted online, as well as our YouTube channel. For those of you who have colleagues who may be interested in urology, our last of the webinar series on VCP residency programs will be on urology next Tuesday. We're going to have a conversation around the supplemental application toward the end of August. And then, as always, one of my favorite activities of the year is the Harvard Affiliated Residency Program Showcase, which will be September 10th. And we are currently planning for it to be live and in person. Thank you to the DICP staff, particularly Lynn, for putting on this wonderful webinar. And we want to make sure everyone has a good day and look forward to seeing you along the interview trail. Take care, everyone. Goodbye.
Take care.
Thank you.